Pfizer and BioNTech have announced a partnership with South Africa's Biovac Institute to process COVID-19 vaccines locally. It's hoped over 100 million doses will be made yearly for distribution within the African Union beginning in 2022. Biovac will receive the drug substance from European plants and will complete the last stage of manufacturing and packaging. Joining us tonight is Vaccines for Africa Initiative's Dr. Benjamin Kagina. Dr. Kagina, good evening to you, and thank you for your time. It really is a step in the right direction, and as far as ending the vaccine apartheid that has been spoken about by activists, but perhaps in your own words, how significant is the step?
Good evening to you, Kathy, and good evening to your viewers. This is very, very good news, and more so at this stage when the continent is lagging from rolling out COVID-19 vaccines in comparison to other continents. So this news really tells us that one of the positive effect of this COVID-19 pandemic is that Africa has now come onto a new way to look at how it's going to solve its problem, and vaccine manufacturing is one of the best ways to do that.
From the statement issued, it looks like they should be able to start with the manufacturing sometime early next year, but in the meantime they'll be putting together some of the infrastructure that is needed in order to make this possible. How far do you think they're going to be able to go in really meeting the need of these vaccines?
Okay, so I think one thing we've got to understand is that we don't have to wait until the Biovac facility is able to fully manufacture these vaccines for Africa to have access to them. So alongside what is happening in terms of Biovac producing these vaccines, African continent is sourcing COVID-19 vaccines through different mechanisms, including COVAX, including bilateral agreements. But coming back to your question, what this technology transfer means is that the partnership has looked at what needs to be done and looked at how this can be done within a specific timeline. And I was very surprised to learn that this could, the facility could be able to make vaccines as early as 2022. So what this means is that we will have a manufacturer of COVID-19 vaccines in the continent who understand the health system challenges that we face in the continent. And in the process of formulation and filling, as well as packaging and distribution, then we will be able to have a very good head start, given that this is happening locally.
So are you hoping that we will have a different variation of the Pfizer vaccine that's perhaps not quite in the form that we have it now, which requires specific cold storage? Is that what you believe will happen for the next phase?
Not really, Kathy, because before vaccine is actually rolled out to the public, the due diligence of testing has to be completed, and the regulator has to be happy. So we cannot start from manufacturing completely new product, because that would really take us back in terms of the process of vaccine development. So because the Pfizer and BioNTech are going to bring the active ingredient here, the process has been well put in place by the Pfizer and BioNTech, and then that process is going to be transferred to South Africa, specifically to Biovac, so that Biovac can do the actual formulation and filling and subsequent packaging and distribution. So when I say that we will have a vaccine that is made by a local manufacturer who understands the health system and the challenges, I'm more talking from the context of distribution, because they will be distributing these vaccines to other African countries. they will be able to start planning with other countries in terms of what the countries need to do to prepare for these vaccines.
You've spoken about the fact that in the interim, there are other means through which countries on the continent are getting access to the vaccine. The COVAX facility was, quite a big one, at least if one thinks back to late last year, perhaps even beginning of 2021. The momentum around it seems to have died, and it doesn't really seem to have lived up to the expectation in as far as delivering equitable access for vaccines to countries on the continent.
You're absolutely right, Kathy. I think COVAX, as much as there was a lot of hope and excitement around it, it hasn't really met those expectations. But I always tell my audience this whenever I talk about this. Outside COVID, any other vaccines, in Africa, we've been waiting for vaccines, new vaccines, for about 10 years before we introduce it to our program. Now with COVID, we do not, I'm talking 10 years in comparison to the Western countries, to Europe and to North America. For COVID-19 vaccine, Kathy, we do not have to wait that long. I know there is huge inequity in terms of access, but that quick access of these vaccines, not in terms of sufficient numbers as we would want, but in terms of the duration between high-income countries introducing these vaccines and low-income countries introducing these vaccines has been shortened from 10 years to just a couple of months. So to start with, I think it's a good positive thing, and COVAX facility, the stakeholders are building onto that experience to make sure that vaccines can be shipped to the African continent. But alongside that, there's also bilateral agreement that countries are agreeing with vaccine manufacturers, and there's also donations coming from high-income countries. But ultimately, the long-term solution to this challenge of vaccine inequity is local production of vaccines. And the Biovac agreement with Pfizer is a very good step to the right direction.
What do you think are the other opportunities that could stem out of this agreement?
So with technology transfer, which is what is happening here, Kathy, there is a huge potential for capacity development. And also this is a very good sign of confidence that the big pharma has on the capacity of South African and the rest of the continent in terms of science and capacity to have this production going. But what is very interesting is that with this technology, which is mRNA, of vaccine development, it offers huge potential in the sense that the technology can be tapped to develop vaccines for other infectious diseases like HIV and TB, which have been a big problem in Africa in the sense that we do not have vaccines against these diseases. So in that way, I think we're seeing a huge potential for this. And of course, this is not just for South Africa, it's for the whole continent. So we can see a lot of collaboration between Biovac and other science ecosystem in the continent that is subsequently going to build capacity for science and technology.
Dr. Benjamin Kagina is from the Vaccines for Africa initiative. Thanks for your time tonight.